Unfortunately, there has been a flood in Nigeria in this month of October. As of the 12th of October 2022, around 2.8 million people in Nigeria were affected by this flooding. I have a very tough question to ask you.
Okay.
At this point, we're calling the cost of living crisis, but my concern is it going to be permanent? Should we call it poverty?
Oh.
Is it a cost of living crisis? Or is it poverty at this point? Hello, Blueies. Welcome to the World Health Investigation Podcast. My name is Jocelyn.
I'm Adna. We are young global health professionals and your hosts for the World Health Investigation Podcast.
Also known as the WHI. We will be discussing all things global health, unpacking the most controversial health and social issues,
as well as promoting new age global health development and equity.
What is the global health tea today?
The topic of today, let's backtrack for a second, because you guys, Jocelyn, as she normally does, she just came to me with this statement. What was it? She said, in an equitable world, poverty shouldn't exist.
Yes.
It's just like,
what's wrong with that?
There's nothing wrong with the statement, but it's like, out of nowhere, he just came with like, what did you think?
I'm making a bold statement, and I'm challenging all people listening to this. Globies, listeners, non-listeners, you should be listening anyways. I'm saying, in an equitable world, poverty shouldn't exist. Let us know if you disagree in the comments, in the description, wherever you can. But I personally think so. But what do you think?
I obviously agree because, like, when you break it down, it's like equity. Equity is everyone has everything that they need that's adapted to their particular situation. If everyone has what they need, why would you be in poverty?
Why would you be in poverty? Yeah, what is equity?
Yeah.
Equity means equitable access, right? Which means that people that would normally be, let's say, at a lower level or at higher risk of something are minimized with that risk. And the people that are at lower risk are simply, basically don't do anything with them because they're at lower risk.
Yeah.
So,
yeah, it makes sense. I agree.
Right?
But then that led us down to actually look into poverty and what's going on in the world. So yeah, kick us off.
So that leads me on to my case study, which is the cost of living crisis. The cost of, I've seen it over the news. We're facing it. I won't say we have faced it. We are feeling it across the globe, not just in the United Kingdom, in the United States, in Europe, in America, so in Africa, everywhere. Everyone is facing some form of crisis. Now the issue is that in America, New York, more than half of them are considering taking extra jobs.
More jobs?
More jobs.
No, you guys, because these Americans, a lot of them are already working 3 jobs. They want more jobs.
I am telling you, the country of rampant capitalism is deciding to take extra jobs.
They're even more.
Yeah, they're even more.
That's crazy.
As a result of this current crisis, as an inflation remains high, employees in the US are combating the soaring prices of essentials like groceries, housing, gas, by looking for ways to increase their income and cut down their expenses. I have a very tough question to ask you.
Okay.
At this point, we're calling it the cost of living crisis, but my concern is it going to be permanent? Should we call it poverty?
Oh.
Is it a cost of living crisis? Or is it poverty at this point?
It's just extra poverty.
Extra poverty. Because we're saying it's a cost of living crisis. That's under the assumption that it's temporary. But I'm not going to lie, I'm a bit concerned that this might affect people permanently.
Yeah. No, I think it happens all the time, especially in the US, for example, where I was saying like a lot of people have like multiple jobs, and I think it's because everyone is so much closer to poverty than they realize.
Yeah.
Like you are one huge medical bill away from just being cast into poverty, honestly.
Just breaking even. You think you have dollars, money in the US, just to make a mistake and fall sick. You will be priced times 10. Anyways, that leads me on to the documentary that I came across that follows 3 working families in the UK, the United Kingdom, not just in the US, also in the UK, 2 parent families and 1 single mom. And all the individuals in this documentary have decent jobs, and some even in the median income in the UK, but are all living in relative poverty currently and have to make difficult decisions about how to spend their money.
Yeah.
So we have one family that earns about £2,000 a month, that's after tax. But after the mortgage, bills, food, they're left with only £63 a month.
Oh my God. 63.
£63 a month. If you live in the UK, you know £63 a month is nothing.
No.
63 for a family. She has 3. This family is a family with 3 children.
Yeah.
And normally, the father of this family has a 75-mile round trip to work every day, which costs him about £18 per day. And they have found rising fuel prices recently that have taken up a lot of their spare money. I saw another case where there's another single mom who works part-time as a nurse. She can't work more than 3 days a week because she can't afford the cost of childcare. And besides being employed, as she's dependent on food and banks and handouts from friends. So after her mortgage, she is left with only £80 a week. For work, for food and everything else for her, as well as her 3 children. So she's left with £80 a week for her and her 3 children.
A nurse,
an essential worker.
Hey,
That leads me on to my point about how essential workers are paid in this country. But anyways,
hey,
that's a topic for another day.
Topic for another day.
But it's just to show that we are going through it, y'all.
Everyone
is going through it. And these are all obviously the economically developed countries, the US, the UK. But yeah, and I think you have some statistics around like, well, what are we expecting this cost of living crisis to be permanent? Is this poverty? And what do we actually understand by poverty?
Yes, that is an excellent question. What do we actually understand by poverty? And yeah, let's just begin by looking at where we are in terms of poverty in the world today. So UN, one of the Sustainable Development Goals, number 1. First one they talk about. There's no order, but this is number 1.
What?
They say is to end poverty in all its forms everywhere.
Okay.
And they obviously have different targets and indicators they use. So the target is by 2030.
In 7 years.
In 7 years, you're right. Because 2022 is almost over. In 7 years, by 2030, eradicate extreme poverty for all people everywhere, currently measured as people living on less than $1.90 a day. That's our target. That's what we're going for, guys.
That's big, yo. That's deep.
And then what happened is progress so far. Well, actually, we are seeing a reversal in the progress that has been made in the past 25 years. And the UN suspects that is due to the impact of COVID-19, and is also made worse by the fact that there's the war between Russia and Ukraine, and we have the rising inflation that we've just been talking about. So all these factors have led to a reversal in the progress that we've made. So if we put that into numbers, between 2015 and 2018, global poverty, the global poverty rate was falling from 10.1% in 2015 to 8.6% in 2018. Now we're not post-pandemic, but I mean, the pandemic has happened. It's kind of still going. Yeah. The global poverty rate has actually increased from 8.3% in 2019 to 9.2% in 2020. And that's the first time it has increased since 1998. We're talking just about extreme poverty, by the way.
That's the first time it's increased
since 1998. I wasn't even born by then. We weren't born by then. No. So all our life, in our existence, poverty has been going down.
It's been going down.
Now it's going up.
It didn't feel like it, though.
You know what I mean. You know what I mean. And then maybe a question to our viewers and to you, Joseph. I don't know about you, but as I was reading all of these and the UN goals and the poverty line, I was like, how do they set this poverty line? Like, how did we get to $1.90 per day as being like the poverty line in our definition? of extreme poverty?
Good question. That's the first thing I thought about.
Yeah.
It's like, how did you decide that $1.90 is the standard?
Yeah.
And it's a standard that people should aim for in lower and middle income countries. That's the assumption.
Yeah.
In the UK, the average person makes around 100,000. You wish. We wish. £100 a day, like $100 roughly, converting plus or minus. Don't quote me. But like the average person makes around $100 a day. You know, it's good in London because London just screws things up. But that's and yet, as I mentioned in the case study, there are families that make more than that, and they still find themselves having to choose between eating or having a heater on.
Imagine.
You know, you're having to choose between whether you want to stay warm or whether or not you need to eat or feed your children. So, do you consider that poverty or not?
Yeah.
Is that extreme poverty to you? Because we're in a different country,
Yeah.
with a different economy, with different conversion rates as well. So, what is the standard, and who determines that?
Yeah. So as for who I'm imagining it's people in the UN a long time ago, before 1998, I suppose, and how they actually came to if you want to know, what they do is different countries have different poverty lines, like you say, because you need to adjust for the fact that cost of living is different in different countries.
Yeah.
So what they do is they take the 15 poorest countries in the world right now, they look at all their poverty lines, and then they take the average of all those poverty lines, and that's how they came to the $1.90 a day.
Yes.
And you know, in general, I'm still like, okay, I understand there's things we can critique about the poverty line and why it has been set there and why that's a definition of extreme poverty. But I still think, you know, there is value in them in that I think they can help all of us understand, like, realistically what that means to live on $1.90 a day, because we all know, we understand. In this UK, $1.90 is maybe one trip by bus, but that's not even enough to take a bus back home.
No, it's not. It's not.
So I was thinking about that you know, by this $1.90 poverty line that we use, when you think about extreme poverty, there's 10% of the world's population that lives in extreme poverty by that definition.
Yeah.
But then it's like, what's going on with the 90%? Like, it's not like extreme poverty, everyone else is rich. You know what I mean? That's not the case.
No,
that's not the case. So our world in data, and you know, they've been very popular, they've been very good around COVID in publishing data and all these things. They actually estimate that 85% of the world population is living on less than $30 per day. And that's like 6.5 billion people in the world. Yeah. Majority of the world is considered to be like in moderate poverty, essentially. Yeah. What do you think about that?
I think that says it all. That answers my question. Around this I'm gonna call it an outcome, right? I'm gonna call this $1.90 the outcome they're using to measure poverty, extreme poverty. And to me, this outcome needs to be updated, because as you can tell, the value of money has changed with inflation and whatnot. You can't be using $1.90 as a standard, because currently, as you said, you have around a large number of people that are earning actually around $20 a day. That's devastating. I mean, I feel I don't know how I feel about that. I feel concerned.
I feel very concerned. And for me, it's, when I saw $30 a day, I did think at first, I was like, oh, I mean, that's like quite high. But then I sort of think of it in my own context, where I'm like, I'm a single person, I don't have kids. You know, $30 might be able to sustain me. But like we're saying, with a nurse, a mother of 3, a whole family, someone who has to pay for gas every day, it's not gonna be enough.
And then there's gonna be I've seen, you know, with some capitalists say that actually, you know, with more capitalism, you need to create more jobs. People have more money, they can work more and produce more money, right? That's the solution, right?
Capitalism is the answer.
Yeah,
capitalism will solve our problems.
That's what I hear people say.
How about capitalism is creating all of these inequalities? How about that? Because I don't like us acting as if capital, like we have this idea of the American dream, and it has been sold to the people. American dream, anyone can just start from wherever and they can make money and be a billionaire. No, all these billionaires that we know right now, did they just get there by accident? Did they just get there by luck and ingenuity and like no. Wasn't that Donald Trump talking about he was given a small loan of $1 million from his father? A small loan. All these Jeff Bezos, Elon Musk, they didn't start from nothing. They didn't just start from nothing.
It's generational wealth. It is generational wealth, and I've seen. I'm guessing because I'm highlighting missing voices in global health. There are people that have said that capitalism is what drives the world. It drives innovation. It is what has led to this. It's reduced extreme poverty from 90% to 10%, right? Therefore, we shouldn't want more capitalism. But the argument against that is, if you look at it more carefully, like, yes, there may have been reductions from 90 to 10% in terms of extreme poverty, around that $1.90 a day, which is, first of all, problematic. On top of that, we've seen that there has been inequalities that has risen.
Yeah.
The gap between the rich and the poor has actually risen by more than 50% during the same time interval. Which goes to show that, yes, whilst there are less people in extreme poverty, it does not mean that these people are living a good quality of life.
Yes.
Essentially, it does not mean that these people are not poor.
Yeah.
And this leads me on to what the problem statement is. It's that there are different definitions of poverty. Poverty does not simply mean, okay, yes, there's extreme poverty, but why are we making it a standard, or should we be proud of ourselves to say that, yes, there are less people in extreme poverty surviving on $1.90 a day? Is that something to be bragging about? Is that something to be boasting? No, because guess what? There are different types of poverty, and I'm going to go into what these are. Number one, there are people that are what we call usually poor, right? No, sorry, occasionally poor. Occasionally poor meaning people experiencing occasional poverty that are more likely to spend long stretches of time above the poverty line. However, if unexpected event happens, such as the flood that happened in Nigeria, or the pandemic that we just faced, or whatever it is, a flooding, whatever it is, this can leave these groups more vulnerable than they are before. So we can say that if you imagine that constant line, or let's say the standard is $1.90 a day, usually they would be below that. But something happens, they have like that, they usually would be above that. So if something happens, they would be below that. So they're occasionally poor. And there are people that are what we call cyclically poor, like cyclical poverty is when you have, let's say, a farmer, or usually, like for example, in Malawi, which is 80% agrarian, which means that hungry seasons and poor harvests can leave families financially and nutritionally insecure. And these low seasons can last for months, and are even more complicated if a natural disaster strikes, such as Cyclone Idai that happened in 2019. And during peak periods such as harvest, there's usually a guaranteed income, right? With these people, usually they're going through this it's like this peak that just like goes up and down and up and down. So imagine the curve that goes up and down, up and down. So if there's like a harvest, yay, we have money. All of a sudden there's some dry season, we're hungry. So that's what's called cyclical poverty. And then there's like people that are usually poor. Usually poor means that usually they're below that $1.90 line, but then something happens such as, there's a good rain after a dry spell, then they happen to have that one period of time, maybe in September in some equatorial regions, then they'll have that spike of, we have our moments of fame or whatever, moments of enjoyment, and then back into the trenches. And then the people that are always poor.
Back into the trenches.
Excuse me, the people that are always poor, and then these people, they're usually like similar to people that are usually poor. These are people that are poor over long periods of time, such as people that have faced famine in Somalia. So they're poor from, similar to how like wealthy people are wealthy from generation to generation. These people are passing poverty from generation to generation. So that leaves me the question of, have you considered, all these different factors, and how are we measuring this poverty line?
That's a great question. I think that's a great question. And honestly, in my view, it will probably be hard for an organization like the UN to factor all of that in, given that, United Nations, it's not just one nation, it's all the nations.
Yeah.
But I do think they don't go far enough in terms of like really laying out that, like, why are we just targeting extreme poverty? Why are we not just thinking about poverty in general? Should the target be extreme poverty, or should the target be how do we reduce inequality? You know what I mean?
That's what my statement is coming from. In an equitable world, poverty shouldn't exist.
Yeah.
So which means we're not talking about extreme poverty. Simply, people should be able to, and there is enough money in the world to achieve that, by the way. Because some people are going to say that, well, why is there a family of 10 anyways? Why are you having? That's what our first.
Why have so many kids?
Why have so many kids if you can't afford them? They should just stop producing kids. We need to reduce the population in the world. That's the solution. Are you for real? What's the problem with that statement?
The problem with that statement, the poor people should just stop having children.
Yeah.
Are you birth control itself? Are you birth control itself? Who are you to tell me how many children to have?
Yeah, essentially. It's a very complicated one, because the big arguments are, capitalism drives innovation. Capitalism is, it's true, like we've seen, like globalization, which is something that capitalism has helped with, like for example the technology. We've seen like nowadays, like the rise of the internet, of social media. We have like high tech, we have things that are useful for us to to enable private enterprises to grow, which is, whilst it's great, it's dismissed the fact that there are people that are left behind. And the reason behind the term equity being that it needs to include everyone. That means the people, regardless of your social status. Like the thing with capitalism is that as much as you think that anybody can come out of nowhere and make millions or billions, unfortunately it's not the case. You can make that much. You can make people stop being poor. Yes. But usually there are some social determinants that impact a person's ability to make that money. Yeah. However, the answer to ending poverty is not a one-size-fits-all. There's no one solution, right?
No. And so now I just wanted to bring this back to our context of health, because this is what we do. As much as I'd want to be an economist and understand all these things, our domain is health.
Yes. Global
health. Yeah. And so, but what happens is we're obviously in a global economic recession, and what that does is it puts a lot of constraints on the government's budget. So they need to make cuts here and there in the budget because of just the economic situation. And then they still need to find ways to fund healthcare. Like people still need access to health. But where is that going to come from, right? Yes. And to just set us, give us in the mood, I think we can all agree that health is a right. Everyone has the right to health. No one should just be like denied health.
Absolutely.
Right. And I have this lovely quote from Tedros, Dr. Tedros.
Hi, you keep on calling him right.
It is my classmate.
Please, Dr.
Tedros. Dr. Tedros. Yes. The right to health for all people means that everyone should have access to the health services they need when and where they need them without suffering financial hardship. No one should get sick and die just because they are poor or because they cannot access the health services they need. I think that just summarizes everything we've been saying so far.
Yeah.
Now the problem is, how am I going to ensure that everyone has that right? How am I going to ensure everyone has access to health? Equitable access to affordable health, because it shouldn't make me bankrupt.
It shouldn't. No, it shouldn't.
Jocelyn.
Oh, what's your approach? What's my approach?
Yes, I've come to you. I said, please, I don't have money. How am I going to make sure people have health? I need to give them health.
I think number one, looking at what our resources are, right, and what our aims are. prioritizing the people that are most at risk. Whilst we have very limited resources, as you said, the issue comes now when we have people with the whole capitalist mindset that wants profit-driven health, right? Which logically it might make sense, right? I get the argument that we need money to run healthcare systems. Money cannot, without money, you cannot run a healthcare system.
No.
However, there's a major problem when we start putting a price to health. Like again, that goes back to my fundamental question: who determines the value of life? Who determines that pricing? And I'm gonna go into that a bit more. I don't have all the answers, but I think we can start from targeting the profit-driven health and actually realigning our priorities.
Yes, I'm glad you brought up profit-driven health, because that's the key thing we're going to be discussing today. And so just for anyone who doesn't know, profit-driven health is basically, it's an argument that's brought up by people who have privatized healthcare. So this can range from people who have private hospitals that are associated with the university, or it can even just be like a private center that provides dialysis for people with kidney problems.
Yeah.
So the key argument from people who are saying yes, we should just give out healthcare like it's another commodity in the market, they say that there's an increased role for entrepreneurs, and the competition that's created when you privatize something like the delivery of healthcare, it will result in a more efficient and effective healthcare system, right? So the main thing for them, at least when it comes to being moral, there's a moral argument still there. Like, we should go for the path that maximizes benefit for the maximum amount of people in the society. Yeah. Right? Yeah. And therefore, a healthcare system that's run by profits will provide the greatest benefits at the least cost.
Is that true? Is that true? And for me, my question is, what is the definition of efficiency? Is efficiency innovation? Is efficiency profit? Because there's no point of you creating a drug, you're doing all these clinical trials when people that need it the most cannot access it. That is not efficiency. Efficiency means amongst the people that have this disease, how many people have used it and it's been effective? Right? Now, if you're investing all this money on this new drug and only the rich people can access it, you might as well, the rest of us, we should just die.
We might as well just die.
We might as well just die. Leave the planet for the rich, essentially.
Yeah. I feel, okay, I'm just gonna play devil's advocate here, because I just thought the arguments were very interesting. So when it comes to this thing of efficiency, they actually think that in our current systems, like public systems, doctors and physicians don't have any incentive to be cost efficient. As in, yes, I want to do no harm, I want the best for my patient, so I think it's this, let's order an x-ray test, actually maybe let's do a CT because I want to get to the bottom of it, but it doesn't. But it's like they don't actually take into consideration the cost of doing all these things and like how to actually make diagnosis in the most efficient way. And they actually claim that on the side of people who provide health publicly, they, at the end of the day, they want to get the most sophisticated equipment and the highly trained personnel, but they don't actually take into account, do we need that sophisticated technology? Do we need to pay the physician that's coming in? He has a good reputation, but we need to pay him more just because. And they're like, no, I wouldn't do that because I want to minimize costs.
Yes. The problem is a lot of the, let's say, we'll call them financial sponsors. The financial sponsors are going to prioritize healthcare businesses or enterprises that make the most money. It doesn't mean they'll be the most useful, it simply means they're making the most money. Now, the issue with that in healthcare is that it's very difficult to put that price on health. It's very difficult to say that, okay, this is how much you're gonna pay, this is we're gonna get this highly reputable person. Like with healthcare, it's a basic need. Like right now, let's say, we're all facing this cost of living crisis. I've heard people complaining that, my Tesco meal deal that usually cost me £3 is now costing me £3.40 on a club card price. And they're all complaining that, for those that don't understand, in the UK, usually there's Tesco, and the Tesco, which is like your supermarket.
Yeah.
And if you have a club card, it's essentially a card that gives you a discount.
Yeah.
So they're complaining that it's expensive. Now imagine that, but with health, where you don't even get the option to choose. You can even, at least with the Tesco meal deal, you can decide to cook at home. You can decide to have like your regular, you can decide to even like meal prep or whatnot to reduce your cost. Now with healthcare, like you are ill, you are physically ill, you have no other option. And if healthcare is costing you more than 60% of your income, that is a problem in itself. And so now answering your question about the issue around incentives and whatnot, I think we should revert to this reverse psychology where let's say like basic necessity, basic pay, right? The GPs and the healthcare workers have their usual pay, right? However much needs to be paid based on the budget. And then people that prioritize the vulnerable groups, like having like equity in health, whatever we're talking about, people that prioritize people that are most at risk get some financial incentives, can get like, this grant or whatnot. That way, that is a good incentive. Obviously, you make it some competition, but we can start there, right?
Yeah. Definitely we can start there. And I think what you're alluding to, I think what they're called, pay for performance. There we go. Pay for performance schemes. Where essentially it's a model for like both in public or private, where essentially you pay your employees and you give them a reward based on their performance. And in healthcare, this can just look like, you reward your healthcare workers or certain facilities based on like some predefined targets that you set.
Yeah.
And the targets don't have to be like quantitative. They don't have to be treat this many number of patients and make sure that this many number of patients have this amount of blood pressure. It doesn't have to be just like that. It can also be about the quality of the work that they deliver.
I mean, yes, that sounds great. But unfortunately, I think in reality, that runs the risk of creating actual workforce demotivation, might create competition. So that's why I initially said that having that base pay where, okay, this is how much the base pay band, that this is how much these healthcare workers are making. And then the people that go the extra mile can get these incentives. That way it can motivate more pharmaceutical companies. If you're in there for the profit, then you can say, okay, I want to make profit, therefore I'm going to help more people. Yeah. We should live in a society where people are rewarded for helping. People are rewarded for thinking about the vulnerable. Have a society where people are empathetic towards people that are not accessing what they're accessing. People that are empathetic are people that are not as privileged as they are. And it's not that difficult because there is enough money in the world to ensure that everyone does that. It's just about how we allocate our resources and what we prioritize.
Yeah. I want to go back to your Tesco club cards, your meal deal, because the other thing I was reading about is they will say yes, health is a basic need. They agree, our profit people, but they also say food is a basic need, shelter is a basic need, clothing is a basic need. You buy all of those. You have many people in the market, many private companies that sell you all these things that are actually basic needs as well. So why can't I also sell health for profit?
I mean, if you put it like that, that means you're putting health with your Tesco meal deal or whatever. You're putting them at the same level, basically. Now, imagine the problem is not that healthcare. It's not that healthcare cannot be priced, right? Either way, you need money to run a healthcare system. As I said before, the problem now comes when it is overly priced. You cannot compare something like food to health because health is life. It is life. Yes, we need food, but imagine that, for example, with this Tesco meal deal, instead of £3.40, it was actually priced £10.
Yeah.
It was priced. That was the price. Imagine it was even £20 for what you should be doing. That's the issue with healthcare. There's a big disparity that people cannot afford it. Even that if you were to go ahead and get that medication, you will be in debt. That's how bad it is, and that's where the issue comes.
100%. I'm actually there with Justin. I completely agree. And I think the other argument, I think in support to what you're saying as well with this profit-driven health is that when you actually think about it, like, yes, a patient is actually vulnerable. And a lot of the times in in economics, they talk about asymmetry of information. And that's basically all about the fact that if you think about yourself as a patient, even me, I'm not a medical doctor. If I have a health problem and I go to it, I'm relying on the doctor to actually have my best interests at heart. But the problem in a profit-driven sort of setting is that the doctor is thinking about profits. They're not thinking about my health at the end of the day. For them, it's like, how much money am I going to spend here? Like, how much money can I get from this person? If they're a poor person, is it worth it me treating them?
Is it worth it? And you know what's weird? It's that a lot of these people that are claiming yes, profit-driven health, they don't trust their doctors.
Interesting.
I went there. They don't trust their doctors. Why are you flying to another outside of the country to get the best healthcare? If you really believe in your healthcare system, why are you flying abroad to get the best healthcare? Some people, even in Switzerland, would fly abroad because they can't afford the price of healthcare in that country. I'm not saying I don't want to target any particular country, but my point is we should live in a place where somebody can trust someone enough in their interest. They can trust someone and they will put their patient's healthcare first. The patient, the vulnerable people first. That's the whole essence behind medicine, right? It's that the patient comes first. Now, when you want to start making profit, the patient is no longer first. It's the mullah that comes first. It's the money that comes first.
Yeah.
That's where the problem comes. We're not saying that you do not need that money. You can still make some profit, but that should not be your priority. That shouldn't be your number one target. I need to make money. This is healthcare. These are people's lives. Let's start thinking about it that way instead of just, okay, yeah, we need to make money and drive innovation. People are dying.
Yeah, that is the other thing with profit-driven health is that when you actually look at it in reality, I was reading a couple of stories like in the US, for example, where they do have a lot of profit-driven health where someone will come to a hospital, a private hospital, and they will literally be denied care. So they will ask them like, oh, do you have insurance or can you pay for this? And if the person says no, they'll be denied care. And people have died from this.
That's very sad.
People have died from this. And that's why it becomes a problem. Because maybe even you're a doctor and you want to help this person, but powers that be, higher ups, people, sometimes your management are not necessarily like medical professionals either.
Yes.
They're people who are there to make money. They're more business-minded people. And so maybe they don't, like we're talking about, they don't look at the value of life in the same way that you, a doctor on the ground, does.
Yes, so unfortunately, it goes back to my point of, what is the value of life? Even the richest people, they can pay all this money in healthcare and they still don't have health. They have all the health in the world, the wealth in the world, but they still do not have health. That shows how valuable health is. Now imagine not having that much money. If you have all that money and you still can't afford to live in a healthy way, imagine the people that do not have the money. So if you're living in a place where everyone is just out there seeking for their own self-interest, you just thinking, okay, yes, I make that money, I can afford to get my care, I don't have to worry about A, B, C, and D. I grew up in a rich household. I have everything I need, all my basic needs and beyond, and my wants and my needs and whatnot. It is selfish. It is selfish. And let's start thinking about other people, not just our friends and families, but people that need it the most. People from across the world that do not relate to us, but they need our help.
Yeah, what I found interesting when I was looking into this as well is low and middle income countries. There was actually a recommendation, I think, from the International Monetary Fund, and this is just like an international financing organization. And they were saying in response to this global recession and governments not having enough money to publicly fund healthcare, their recommendation was that low and middle income countries should actually invest more in private healthcare. That was their recommendation. They said this is what they need.
Yeah.
And actually, in reality, when you look at it, apparently a lot of low and middle income countries, they actually do a mix in terms of like publicly funded healthcare and private. And I actually came across a study that looked at both, and you just evaluate like a compare and contrast to see like what's going on. And so they reviewed publicly available data about public and private sector healthcare performances in low and middle income countries, as I said. And they were assessing based on World Health Organization has these 6 criteria, these 6 essential themes of health systems: accessibility and responsiveness, quality, accountability, transparency, fairness and equity, and efficiency, right? So that's what they were looking at. And overall, what they found in the end, in low and middle income countries, the private sector healthcare systems tended to lack published data so that they could actually evaluate all of this. Apparently, they're not sharing their data. And these private sector healthcare systems also had greater risks of low quality care and served higher socioeconomic groups, like we're talking about. And then on the other hand, we had the public sector healthcare systems where they actually tended to be less responsive to patients, and they lacked availability of supplies. And when we're talking about being less responsive to patients, like they did a survey of all the patients to see what they think about like healthcare that's been provided to them, and they were talking about things like, you know, how polite the healthcare workers are, how clean is the facility, and all these things. And so that's what they were finding. And interestingly enough, in low and middle income countries, they're thinking that private sector healthcare systems were actually less efficient.
How ironic.
They had lower efficiency than the public sector. And this is what I found interesting, is like they think it's because basically in the private sector they'll charge higher for drug costs, for drugs, and then they'll actually be the ones that end up ordering unnecessary tests, because obviously the patient is paying for all these tests. So me as a doctor, I'm like, yeah, do this one and that one and that one. So in that way they actually end up being less efficient. So
that's a very ironic statistic. That's a very ironic statement, because the whole point of profit-driven health is, you know, drive efficiency, right? Innovation. I mean, obviously, no system is perfect. Like, I don't think we'll ever get to a point where we have a healthcare system that satisfies everybody equally and whatnot. No. But I think for me, it goes back to my point around, are the most vulnerable people accessing what they need? Because the people people that are at low risk don't need healthcare as much. And for me, as long as the people that need healthcare the most are accessing it, then we're on our way towards equity. We're on the right track. But if we're in a place where, you're prioritizing a private healthcare, and that's your sole form of healthcare, that's your primary healthcare system, and you're ordering extra tests, you're expecting that some of these tests are not even necessary. No. They're running all these clinical trials, but not all of them are actually needed. And that's where the mistrust comes in sometimes. But even in the richest countries like Switzerland, I've seen is that people do not trust their healthcare professionals, because they are assuming that they're going to make profit off of them. They're going to assume that if your doctor recommends you get this drug, it's because he's going to end up getting more profit off of you going to get that drug. Not because he or she actually thinks that you need it. And that is a problem.
Yeah, I'm not even gonna pretend on that one. They are like the dentist, for example. In Switzerland, obviously the system there is that everyone has to get private health insurance, and they cover certain things, but they don't cover teeth. They don't cover any kind of dental work. And anytime I go to the dentist, I'm like, are you sure I need this?
Exactly.
Like, do we really need to operate on me right now? Do I really need to go all the way to this other facility to get all this radiology stuff for you to come and tell me the same answer anyway?
Yeah.
You know what I mean? It's like when the health is at my cost, it now means I'm like health, my money, my money.
Yeah. That's what you're supposed to have 2 dental checkups a year, but I know many people don't do it because they can't afford it.
No.
And that's a problem. So now think about it that way. It's not that it's not impossible to prioritize what's essential. over profit. I'm not saying that you shouldn't make profit in health. That's not what I'm saying. I think a balance, we've actually seen that a balance of both is good. Like with a system where you have some social care, you have some this, you have some that, a balance of both. But if your priority, your number one aim is to make profit off of people, vulnerable people, that's problematic.
That's very problematic. So overall, do you think capitalism is bad for health?
That's a little question.
I just wonder, like, do you think capitalism is bad for health?
Capitalism, do I think it is bad for health? I think it poses serious health concerns.
Yes.
I think
it's a risk.
It's a risk.
It's a risk factor to health.
It's a risk factor to health. Yes, make money. But we're in a global world. It's not just about you. It's think about other people as well.
Yeah.
And that's my whole essence. That's my whole statement.
Yeah.
It's that. Yes, we need the innovation. Yes, we need the technology. We need the private enterprises to strive. But we need each other as well. We need to work in a collective manner. We need to incorporate different areas of expertise within health. Even the economists can come in, the socialists, the social workers can come in, socialist theories, whatever. We need to come together to reduce inequalities in healthcare. And does capitalism do that? I said earlier that capitalism has actually increased the gap in inequalities over the recent years. So, to answer your question, I think it speaks for itself.
It speaks for itself. Is capitalism bad for health? I think the answer is yes. At the same time, I don't want to just make it seem as if capitalism alone is the only thing in the world that can lead to bad health.
Yeah.
You know what I mean? It's not as if in Soviet Russia, when it was still a communist country, it's not as if in places like China that, you know, simply because they're not completely capitalist, suddenly they're like better for health. Like in China, we see there's a lot of problems with like air pollution and stuff like that because of just a lot of the manufacturing and how industrialization there is working. In Soviet Russia, a lot of the times the problem with people was like foods. They just didn't have enough money for food. They had a lot of hunger.
A lot of hunger. No, it's true. And linking back to the issue, it goes back to the climate crisis, right? It's like the innovation. If we're not thinking about other people, we're not thinking about the green world, then what happens is our planet also is at risk and whatnot. And it's not to. I don't want to just make it like, okay, capitalism is just bad and it's a reason for all the problems. Right? That's not what I'm saying. What I'm saying is even in somewhere like the US, right? The country where with rampant capitalism, the number one, the leading capitalist economy, even with them, they're starting to experience increased levels of poverty in the recent years. And I've looked more into this, it's due to the fact that a lot of Americans take opioids to survive throughout the day. To survive throughout life, the pressures of working four jobs.
To be productive.
To be productive. That pressure to be productive ends up being counterproductive because even the life expectancy, for example, because I've also heard capitalists say that no, but capitalism has driven, has led to better life expectancy, right? Over the recent years, because we've seen that back in the days around in the early industrial revolution, around that time we could see that life expectancy was about 50 years. Now it's gone up. It's gone up to I don't know the value, but I know it's gone up. And now it's reaching a point where it's starting to stagnate, if not going down. And that's in the UK as well. Like we have an older population, etc. So it's to say that encouraging people to be overly productive may not actually be the all-time solution.
No, it's not. And what comes to mind is, for example, allegedly, in some of the factories in Amazon, I'm sure like a lot of you have heard, for example, to maximize how much time and how much stuff they can get packaged in through the line, they actually minimize how much time someone can go like to take a bathroom break. Some people are reporting, allegedly that they're standing in that line packaging stuff for like 10 hours straight in the day, no breaks. You know what I mean?
Yeah.
That's, I'm not gonna lie, it's sounding like slavery. It's sounding like slavery. And this is an association we know about in factories where IT issues are being made allegedly. Child labor.
We say
allegedly, child labor, this whole idea of again just being driven by profits, and then I think you lose sight of like the value of like human life and working conditions for humans, because you're now thinking, this human's actually just like slowing me down. If they could just work faster.
And the whole idea behind the American dream is like, if you work hard, you will be successful, right? The whole essence behind capitalism is that finally there's a free market, I quote free, a free market where anybody can buy what they want, sell what they want, work hard, work this number of days, and they will be able to be successful, and they will no longer be poor. If you work hard, you will not be poor. Unfortunately, that's not the case. The hardest workers are the ones actually working for these factories. They're working hours. They're working extremely long hours throughout the week, and yet they're not compensated as much as they deserve. And yet we see billionaires that are making so much money off of this company at the expense of these people.
Yeah. I'm sorry, it's slavery. Allegedly. So with that in mind, we got very round up there. What can we do better?
What can we
actually try to do better? I think we alluded to this when it came to talking about inequalities and actually tackling inequalities, because in my view it's like, if you have universal health coverage, if you have a universal basic income, you're not gonna drive people into extreme poverty where, as we saw in our case study, they're deciding, do I stay warm or do I eat? Cover all the basic needs.
The basic needs.
What are your thoughts, Jocelyn? How do we end poverty?
How do we?
Easy question.
See, me, if I had the answer, would I not be president? I don't have the answer, but I can share some ideas that could help us get there, that could drive us there. We can start looking at what exactly is poverty, right? What drives poverty? Okay. What poverty is like if you lack assets, let's say assets could be food, drinks, your TV license, your whatever it is that you have. You lack assets, and two, you lack a return on those assets. Meaning that whatever it is that you own does not make you money. Either it's not enough, or it does not. You see no return on that. That's the essence of poverty. That you simply do not have enough. Yeah. There is a scarcity. Yes. Now, what drives poverty is that there are two factors. Okay. Inequality, as we said, Edna, and risk. Inequality can be understood as the difference of social determinants, such as gender, race, ethnicity, ability, health, social status, welfare, and age. So those are the things that could either affect someone's ability to access certain services, afford certain things. And number two is risk, such as hazard, vulnerability, illness, such as we've seen the pandemic, cost of living crisis. That's risk. So you put those two together, there's a very high likelihood that this person will end up being poor. For example, if I happen to be someone that is, maybe let's say I'm disabled, I'm not fully able to run my daily activities, and I'm a woman living in Somalia, and I'm facing famine, then the chances of me being poor are going to be very high. They're going to be quite high. Now, in order for a community to find their way out of poverty, all groups, first of all, must be involved in the decision-making process. So we need to reduce those inequalities. And the best way to reduce those inequalities is to start by ensuring that within municipalities, like within local groups, there are people that are representative of all these different inequality groups, right? So for example, in a local authority, you have someone that is, I don't know, like black or brown, that actually fights for those interests as well, not just placing someone there just to tokenism, you know. Someone that actually fights for those and seeks the interest of that particular population.
Yeah.
And then the next step is now assessing the risk. Risk is a combination of a group's level of vulnerability and the hazards they face. So like, you know, that hazard means, how can I describe it? Hazards could be the likelihood of you being at risk of something. Like the basically is likelihood of running a certain, of either surviving or dying or whatnot. So the more hazards they face, the harder it is to break the cycle of poverty. So what we need to do is reduce that risk, reduce these barriers. And what does that mean? Being better prepared, number one, being better prepared for emergencies. Like as I was mentioning earlier around the floods in Nigeria, setting up systems, for example, that would have a reservoir for water in case a flood happens, so your population does not end up losing all of its assets in case of a flood. That's one example. Number two, just basically trying to see what are the barriers that your population is facing and how do we address each of those barriers in the process. I think that's as I said, there's no one size fits all solution because different countries have different populations and different demographics, but I think that's a great way to start.
No, 100%. And just even on that point, like that's the whole idea of equity, right? And what we have been saying when it came to the poverty line of like the way you tackle extreme poverty and the people who are like that below that $1.90 may not be the same way you do for the people that are living, you know, in moderate poverty. But I think at the end of the day, if you're able to make life better and easier for the people in extreme poverty, it will end up benefiting everybody else automatically. If I make sure that I have a reservoir like you're talking about, if everyone has access to clean water, access to education, all of these things, it's just going to benefit everyone.
And that's the problem when we start to prioritize profit, is that we forget to think about these things. The thing is, when we prioritize profit, everyone is fighting for their own interests, right? They're trying to make money for their business. If I'm running an energy company, I want the energy bills to rise, but I'm not thinking about the other people. Whereas if we think more collectively and try to, you know, reduce those barriers, not just at an individual level, but on a population level as well, then we can start to see improved outcomes in terms of poverty. And that does not mean prioritizing profit. I do not think that prioritizing making profit will help us get there. I think we need to realign our priorities such that even if we end up making profit, at least we know that there are not people that are living in these extreme conditions.
I agree, and I think what you said even at the beginning is like there's no perfect system, and I think in an ideal world we would have a mix of like both public and private, you know. Like sure, like capitalism, I do think, you know, that idea of having competition, it does help at least drive costs down for people in general. But you know, like you were talking about energy, like I could just charge people however much I want, but you still need that public government authority to come in and protect people at the end of the day. So I feel like we always need like this balance of like the public and the private.
And just from just tackling this topic, it's made me really understand the importance of political will. If you have a leader that does not put the interest of the public first, the vulnerable will suffer. I think we know that, right? We've seen that. So when it comes to things like, especially with floods, the pandemic, imagine we're facing a pandemic and your number one priority is how much money is in your pocket. Of course, there's going to be a crisis eventually. If you were thinking if your primary goal was to make profit for your business, you're not thinking about others, something like a pandemic hits and we're facing inflation and an economic recession, you cannot be surprised this has happened. You are not prepared for the interest for the population. You are looking at your own self-interest, and that is problematic.
Yeah, agreed. So what can we do in our daily lives? Eradicating poverty, UN SDG goal. Since UN was formed, I don't know. No, SDG goals came a bit later. Anyway, the point is, if the UN could have done it and solved it at a global level, it would have been done. It's clearly something that is difficult, but surely there's something on a day-to-day basis that we can all do to help people who may be in extreme poverty or just poverty in general.
I think this obviously may not be the best answer for everyone, but my initial reaction from when I was just reading the news and reading what's currently happening was like, I need to help people. I need to donate. I need to find, like, even with this Nigerian flood that happened, like, just maybe find a charity or an organization that would help maybe build this reservoir. Obviously, that runs the risk of being exploited, but I would like to know that my resources are being used effectively. But that makes me think, okay, this cost of living crisis is affecting everyone, but it's affecting other people even more than it's affecting me, and it's making me think that I need to help other people. So I think, what can we do better in our lives? I think, one, like, actually seek out to organizations around in your local area, not just maybe abroad, even in your local area. Like we've seen, even in London, there's the rise in homelessness. This cost of living crisis has led to more and more people being homeless. So yes, help where you can.
Yeah.
What I'm gonna say. That's what I was almost impulsed to think from me. It's like this is alarming me that I need to help these people. It makes me feel like I need to help these people as well.
Yeah. No, completely agree. You can always donate food to food banks. I think a lot of us just sometimes if you don't eat lunch out that week or something like that, that little extra, even £3, if you just buy a sandwich, I don't know, for someone, it could help, it could help. I'm not saying you have to starve yourself, but, if you make your meal at home that day instead of buying something out and then you use that money, you give it away, you buy food that you go give that to food bank, that could help, I think. And for me, growing up as well, we always had this saying in my house, I don't know if it rings true everywhere, but charity begins at home. Poverty, you don't always have to be thinking about the starving people in Somalia or people all the way over there faced in Yemen. Yes, think about those people, donate where you can, but it could also be closer to home. Like check on your friends. There could be someone that's struggling, because some people feel ashamed
to admit it. Yeah,
they feel ashamed. Like you think, yes, we all went to the same schools and blah blah blah, we should all have the same access. Someone is struggling to have food. They could be struggling, and you work with them or you go to school with them. So check on people that are around you. Sometimes it's even in your own family. If people in your own family are struggling, that's why, to me, I'm a believer in, like, before you start going out to try and change the world, like, at least try, look within, in your own home, in your own family. Can you make change there first?
Yes, I think just that's brilliantly said. Just echoing that, we just need to live in a world where there's a bit more empathy. Sometimes when we read this news, it sounds like statistics to us. You hear 2 million people, 8 million people. It sounds so, it sounds like a statistic, but these are real people, these are real lives. And even with this measure of poverty, this measure of extreme poverty, you're only measuring based on how much they earn a day, like $1.90 a day. It's nothing, right? It's basically nothing. But there's so many other factors that come into play as well, such as even the gender, like access to education. Like some of these people are not even able to access education, and the main driver for this is that many women and children in these places cannot afford into marriage before their 18th birthday. Those are the things that have driven poverty, and that's also I'm calling, alerting institutions, corporations, NGOs to factor that in as well, instead of just saying, okay, yeah, extreme poverty has reduced and we are in a much better place. But let's look at poverty in a much more holistic perspective, much more holistic perspective, meaning that includes things like education. Has he or she actually completed their education? Are they able to afford quality healthcare? Are they able to eat? Are they able to afford heating? And it's not to say that people that people that are rich are no longer going to receive money. It's not the problem the problem is not that rich people make money. The problem is that poor people that are non-affluent are really struggling and they're very vulnerable. Look, think of it that way, because I know people that have said that, why are you trying to stop people from being rich or whatnot? That's not the problem. We're not particularly concerned that you're making X amount of money. Good for you. But just remember that whilst you're making all that money, there are people that are battling their life every single day.
Mm-hmm. Yeah, my last thing I think would be to policymakers, or not policymakers necessarily, but just people in the humanitarian world. I think it is really important. We do need humanitarian aid in times of crisis, war, crisis like what happened in Nigeria with the flooding. We just need urgent help. But I think, again, we shouldn't just think that giving people more money and the thing that they need is going to eradicate poverty. It's not enough to get us there. And I think it's linked to what you're saying. We need to look more at the basic needs of a person and making sure they're in an environment where they can meet those needs, whether that's, targeting more like governments of different countries, or, building more programs and projects that, center around like sustainability and like ownership in the host countries that you're delivering your project.
Absolutely. Thinking more long term.
Yeah. So those are our thoughts on poverty. In conclusion, in an equitable world, poverty should not exist.
Come
it should just not exist.
We've said it. Come and find us.
Yeah, we dare you. I don't know how you can convince me.
Yes, if you think otherwise, comment below. Tell us why.
Yes.
If you are a capitalist or if you believe in a different movement, please tell us why. Educate us.
Yeah, honestly, we believe in this, but you're entitled to also believe in other things.
Other things.
Can't change my mind. I want to see the other side.
I want a challenge.
Yeah. Challenge. So thank you so much for joining us this week again for the World Health Investigation podcast. I'm Edna.
I'm Jocelyn.
We are young global health professionals and we've been your hosts for this episode of the World Health Investigation podcast. Please
and thank you very much for listening. Do not forget, we have an event coming up. Please speak of the unspoken.
Yes.
You have listened to us today. We've had it to the few things, but we're going to go even further during this debate, tackling the most controversial topics live. Okay, you do not want to miss this. If you're in London, come through in person. If you are abroad, it's okay. We're going to be streaming it back. It's a free event for you to join us in the conversation and have your say.
Yes.
So register ASAP on the 9th of November 2022.
Yes.
Get those
Join
tickets.
us. Get your ticket. We'll put all the links in the bio. And as always, remember to follow us on our socials. On Facebook, LinkedIn. Look up World Health Investigation Podcast.
Yes.
On Twitter and on Instagram, we're at WHI_podcast. Follow us everywhere. That's how you get your feed, any updates on what we're up to.
Yes, and if you want funny banter on TikTok. We're also on TikTok.
We're on TikTok too.
We recently joined, so please support and join the movement.